Good evening, everybody. Today, what I am going to discuss in this class is what is the definition of anemia and what is the etiology of anemia and the general classification of anemia, the general clinical features of anemia that we are going to discuss in this class. So, the specific learning objectives is the definition, classification, and general clinical features of anemia. So how we can define anemia? Anemia can be defined, it is not a single disorder, it is a group of disorders in which three different parameters should be taken into consideration like the hemoglobin concentration, the PCV, that is the packed cell volume, and RBC count, million cells per cubic millimeter or million cells per millimeter cube. If these three values are less than normal, then we can call that particular person he or she as a anemic. So hemoglobin concentration 13 grams per dl in males, 11.5 grams in females, or 15 grams in newborn, 9.5 in infants. That we can call it. That is regarding the concentration of hemoglobin in the blood cell. So depending upon the concentration of hemoglobin, you can give a grade the we can grade the anemia like mild anemia, moderate anemia, and severe anemia. Mild is between 8 to 10 grams per dl, between 6 to 8 grams per dl hemoglobin, that we can call it the person is having moderate anemia, and below 6 grams per dl, that we can call it severe anemia. So, with-based classification regarding the cause of anemia and depending upon the concentration of hemoglobin, depending upon the shape and diameter of a red blood cell, depending upon the count of the RBC, that we can call it as a Winthrop's classification or morphological classification. So, etiology means it is the reason for the disease or cause of a disease. Cause of a disease. So, this we can see there are so many causes for anemia that we can call it as the etiological classification. Etiology is the cause. The meaning for etiology is a cause. So that deficiency anemia, the best example you can write iron deficiency, vitamin B12 deficiency, the folic acid deficiency, and the deficiency of remaining trace elements. Next, the third one is the blood loss anemia. So you can take the best example is the piles, hemorrhoids, piles, fissures. All these are the best examples of the blood loss anemia. Then coming to the hemolytic anemia, hemolysis means the breakdown of red blood cells. That intervascular hemolysis. The best example for hemolytic anemia is jaundice. The second example is mismatch in blood transfusion. All these are the causes of hemolytic anemia. Then coming to the fourth one, it is aplastic anemia, where the bone marrow will completely go into the dysfunction and all the three cells like thrombocytes, leukocytes, and erythrocytes, they do not produce, they do not synthesize, and the bone marrow will not function at all. So such anemia we can call it as a aplastic anemia. Here the person purely dependent on complete blood transfusion for every fortnight. Next, we can take different chronic diseases, the diseases related to lungs, diseases related to kidney, diseases related to heart, diseases related to liver, diseases related to the blood cells. All these chronic diseases, they lead to the diseases of chronic diseases, anemia, which is caused due to different chronic diseases. So these are all the vid-based classification or etiological classification. Next, coming to the morphological or Winthrop's classification, you can tell it is a normocytic, normochromic, acute post-hemorrhagic anemia, hemolytic anemia, and aplastic anemia. Here you can see RBC are normal, RBC count is normal, the size is normal, the concentration of hemoglobin in a single red blood cell is normal, it is called acute post-hemorrhagic anemia or hemolytic anemia, where you can see the mismatched blood transfusion, the complete dysfunction of bone marrow, that we can call it as a aplastic anemia. Next, the microcytic the microcytic hypochromic anemia. It is a typical feature you can see in iron deficiency anemia. Iron deficiency is a very common deficiency in females when compared to males in India. Due to so many reasons, that is due to malnutrition, due to improper intake in diet of Fe2 plus. Next, the chronic post-hemorrhagic anemia. Post-hemorrhagic anemia, you can see after the post-surgical anemia. Due to major surgeries or minor surgeries, there is a huge loss of blood that leads to chronic post-hemorrhagic anemia. Then coming to the thalassemia, it is a congenital disorder that also leads to microcytic hypochromic anemia. Next, coming to the macrocytic normochromic anemia. Macrocytic normochromic, the RBC diameter is increases, that is macrocytic. Even though the red blood cell size is more, we have the normal concentration of hemoglobin, that we can call it as a normochromic anemia. That we can see in the deficiency of vitamin B12, deficiency of folic acid, that we can call it as a megaloblastic anemia. The deficiency of B12 we can call it as a pernicious anemia. Deficiency of intrinsic factor of calcium. For example, if a person or any individual, he or she, he suffers with and chronic disturbance in the stomach, increases secretion of HCl and decreases secretion of HCl, or any, if the person uses many proton pump inhibitors like omeprazole, rabaprazole, etc., that damages the mucosa of the stomach, which leads to the dysfunction of intrinsic factor of Cassidy. Deficiency of intrinsic factor of Cassidy leads to the malabsorption of vitamin B12, which leads to deficiency of B12 deficiency anemia. Next, these are all the general clinical features of anemia. We can see the pallor. The palpable conjunctiva is pallor. You can see generalized muscular weakness, respiratory symptoms, dyspnea. The person breathe very difficulty. The person feels difficulty in breathing. That we can call it as a respiratory dyspnea. Next, the heart rate increases in anemia. That is the cardiovascular manifestation. Next, in the central nervous system, we have disturbance in the functioning of central nervous system. The person cannot concentrate on anything what he or she is doing. We have the diplopia, double vision, or that we can call it as a ocular manifestation, and you can see improper digestion, that is concerned to the GIT, and the person cannot perform the normal sexual function regarding the reproductive system, and the GFR decreases, that is regarding the kidney, and lastly we have all the decreased basal metabolic rate symptoms, decreased body temperature, decreased pulse rate, decreased respiratory rate, decreased heart rate, etc. Next, it is a very common deficiency in India in females when compared to males. That is dietary require. That is iron deficiency anemia. So daily requirement and dietary sources of uh, iron causes iron deficiency anemia. So the clinical features are same as in normal anemia. You can see what are the different laboratory findings, the blood picture, red blood cell indices like mean corpuscular volume, mean corpuscular hemoglobin concentration, mean corpuscular hemoglobin, the bone marrow biopsy, and the biochemical findings in the treatment of iron deficiency anemia. So you can see this this blood picture. It shows the picture which is concerned to iron deficiency anemia, where we can see the size of the red blood cell decreases more when compared to the normal red blood cell size. So here you can see the picture which is stained with Leishman stain. This is a decreased size of RBC, that we can call it as a microcytic hypochromic anemia. We can see the iron deficiency anemia. Next, the megaloblastic anemia. The main cause is the deficiency of vitamin B12. Vitamin B12 plays a very important role in the maturation of red blood cell from reticulocyte to normal mature red blood cell. So deficiency of vitamin B12 causes megaloblastic anemia. And Edisonian pernicious anemia, megaloblastic anemia due to folic acid deficiency. Folic acid plays a very, very important role. It is a maturation factor, characteristic feature of megaloblastic anemia. See, this is a diagram of a stomach which is having a J-shaped structure. The superior we have the cardiac sphincter, the inferior we have the pyloric sphincter, and in the stomach we have the stomach lining are the parietal cells. And here you can see the intrinsic factor of Cassidy. So this is a very, very important factor. This intrinsic factor of Cassidy plays a very important role in the dietary absorption of vitamin B12. It plays a very important role in the synthesis of vitamin B12, which is a maturation factor for erythropoiesis. See, this is called a megaloblast, a large red blood cell, large diameter red blood cell. You can see it is the megaloblastic anemia. So osmotic fragility. While testing the fragility of the red blood cell, that test is called osmotic fragility. You dip a given sample of red blood cell in different concentrations of sodium chloride, that is 0.48% of sodium chloride, which is we depending upon the tonicity of the solutions, you can divide into three types of solutions: isotonic, hypotonic, and hypertonic. So if you dip the blood cells in all these three different tonic solutions, we can see the in the hypotonic solution red blood cell breaks. Hypotonic solution red blood cell shrinks. Isotonic solution there is the normal morphological features of a red blood cell. That is the test of osmotic fragility. So the congenital spherocytosis, autoimmune disease, the G6PD is glucose 6 phosphate dehydrogenase deficiency, hemolytic anemia, and the venom of a cobra has a sufficient capacity to break down the red blood cell, and that's why the person died due to the cobra bite. Why? Because all the blood cells they break down, and these blood cells they break down and directly that is called as a hemolysis, and the person died due to hemolytic shock. Thank you.